so pleased to be joined by Ryan Igleheart, Associate Wellbeing Manager for Humana, to talk about using data to design workplace financial health solutions. Ryan is part of the team that designs and implements financial well-being solutions for Humana's associate. He was also a leader in the effort to develop Humana's Associate Wellbeing Snapshot, which is a really unique and sophisticated tool that provides the company's leaders with a 360-degree view of associates' well-being across several dimensions. Ryan, thank you so much for being here today. Let's talk about the Wellbeing Snapshot. What is it? Why was it built? How did you build it? Who was involved? Love to hear that story from you, starting from the beginning.
Yeah, Beth, I'm happy to be here today. Thank you very much for the opportunity to join, and certainly I'm happy to share any insights that we have regarding the snapshot. Specifically, when Humana started on what we sort of term our well-being movement and our well-being journey, that term is quite commonplace now, but Humana identified it about 11 years ago and began to define that term of well-being. As a healthcare company, we had long talked about health, primarily physical health and things of that nature, as a focus for us, both for our associates and members. But as we pivoted to well-being, we defined our 4 pillars as health, security, purpose, and belonging. Specifically, each of those pillars has some sub-pillars. For instance, health has physical, emotional, spiritual under the health component. Specifically, as we embarked on an effort to really integrate well-being across our enterprise in how we served our members, it was apparent that we had to demonstrate some of that commitment on our own associates as well. What they felt as employees of the company would then be reflected back to our members that they served. And so in 2012, I was leading a team that had ownership of health analytics and data. And as we pivoted, we found ourselves pulling in more and more data sources that we could look at as a company. And it was almost overwhelming. There wasn't a lot of ability at that point in time to sift through the various data sources and be thinking about which ones were actually driving outcomes, which one were important for our associates and leaders to focus on. And so what we did is we stepped back. We sort of dumped all of that data on the table, and then we sifted through it. And across those 4 pillars of well-being, we found about 150 metrics that we felt like gave us sampling. And not necessarily, we didn't know at the time that it was the right exact metrics, but gave us a sampling of key metrics across the spectrum that would allow us to understand sort of whole person and whole company, whole enterprise well-being as best we could. That included things, on the financial realm. We're here talking about financial health today, such as, what percentage people were contributing to their 401k, HSA contributions, earning incentives that were offered as part of the health plan or being an employee. But it also included things like questions from the engagement scores about people being connected to a sense of purpose working for the company. Or frankly, some responses to the health assessment about, the rates of smoking or obesity, how people felt about their diet and their nutrition, things of that nature. And then here's what I think, is the really interesting thing that we did with it that may be a little bit different because I think a lot of people's companies look at that kind of data in an HR capacity. We decided that we were going to, in some ways, unleash this data by organizing it around the various functional organizations within the company and sharing it with leaders that had at least 250 or more associates. And so we organized this and gave every leader that led that large of an organization or larger a snapshot that had their specific individual's data on it. Not anybody at an individual level, granted, it was all aggregate, but it really allowed for them to feel like it wasn't just an enterprise measure. This was something personal, and they were sort of forced to take ownership of that data. And we also allowed them to see where the enterprise was. And so they had a sense of where they stood related to the overall enterprise. And I think that is what really started the snowball of our culture shifting, so that we were, as a group of leaders of HR that was organizing the data and sharing it and consulting around it, accountable for improving those metrics.
Yeah, I'm glad you mentioned that last part about the additional step that you took to share the snapshot with those leaders, because I think that's what's one of the things that's really unique about your approach is the degree of transparency and
Right.
sharing of information across the company that you've taken through this process. I'm wondering if you could say a little bit about how access to all of this data has informed decision making about associates' well-being and about the benefits you offer, both at the level of the HR organization, but in light of the fact that leaders across the organization have access to this data, how has this shaped their decision making?
Well, I absolutely, I think it has changed some of that way that we have thought about decisions. To be clear, when that data, we leverage the data, we really empower those leaders, as I said before, to sort of take ownership. We were able to identify some areas where there were best practices that we weren't able to before, because we were segmenting it and looking at data and trends by specific areas. And so not even necessarily just offering benefits or external programs, we were able to figure out there were some areas of the company, and 30, 40, 50,000 people, there were some pockets that were doing some really great things on their own that we were able to then translate some of those best practices across the enterprise and really share with other leaders so that we were able to, develop more of sort of almost an innovation mindset around well-being internally at a grassroots level, in addition to some of that external, to your point, sort of sourcing of, going out and getting a vendor to fill a gap in benefits that we might have and that kind of thing. I certainly also think that it did help identify, some of those gaps that we could plug with additional benefits, support, programming, education, et cetera. And a lot of that came not just through the data and the data saying, well, this looks a little bit low here, or that kind of thing, but those conversations. And so we went out as a team, and when we were delivering these, a lot of these leaders are very operationally minded. They want to dig into the numbers, but they want to talk about, well, what's driving this? How can we improve that? And I think a lot of that dialogue is really where we can help identify some of those. One of the solutions that we implemented last year is an earned wage access solution. And the initial concept for that came through one of these snapshot consultations a couple of years ago, when that kind of concept was still a little bit more in its infancy. And then the pandemic hit, and that was the right opportunity to implement that solution. But I remember having a conversation with a leader, who leads a large organization of individuals who are relatively more moderately paid, based on, sort of being a more call center focused in terms of that employee population. And that was a solution that she had heard about, and had brought to us, and that sort of started the ball rolling of awareness and interest in that solution. So it's not just the data, but it's really what the data enables in terms of the shared ownership in some ways of thinking about solutions that can help associates.
Yeah, I think that's a really interesting example of how the data transparency has led to a shift in culture, as you said earlier, and the positive benefits that can flow from that. I'm wondering if you could say a little bit more about, once the data enables you to identify a specific need, how does Humana think about which solutions might be the right fit for your associates? Maybe the earned wage access is a good example, or maybe there's another example that you could point to.
Yeah, I'm sure. I'm happy to speak to that solution, but also others as well. I mean, the reality is that solution is one that we were toying around with the idea for a while before we actually pursued it. We had a couple of conversations with potential vendors, and the laying the foundation, it seems sometimes, is in an HR capacity is one of the hardest things to do. There's questions of justifying of things. That one was actually very fortuitous, where we already had some of that foundation and knowledge and awareness. And then when the pandemic did hit, and we sort of everybody transitioned to working at home last March, March 20th or so last year, we were having a meeting about, this is going to be bad, in terms of the financial instability. What can we do to really help support our associates through this? And so I think that's something that it was already in some ways ready. I hate to say it. We were already sort of partway down the path of actually developing that solution. And so I think the reality is that once we get to that point, we obviously have a process of working with our IT partners and helping to vet and select an appropriate vendor. I will say that we have several lenses. When we step back and think about our benefits, we have several lenses that we look at. They include talent strategy, what's going to help us attract and retain the talent we need to execute on the company's priorities and strategy. External competitiveness, we certainly look at what other companies out there are offering, both for ideas, but also to make sure that we're keeping our benefits within reasonable ranges, so that we're not falling behind. Financial considerations, everybody has a budget, and as do we, and that has to be a point of consideration. We also look at associate preference, though. That's something that not necessarily tied to the snapshot specifically, but we actually have used an analytical process called conjoint analysis over the last dozen years or so on several occasions to really ask our associates what they value about benefits. And that conjoint methodology allows you to sort of force trade-offs and get a lot of really deep analytics about what they really value. Because everybody can say, I want more benefits, I want more well-being incentives, I want more 401k, and more vacation days and things of that nature. I think that what really you have to be able to do, though, is to understand it in a hopefully a more nuanced manner and really understand what people's trade-offs are. And so that has allowed us in a very analytical sense to invite our associates into the conversation, ask them what they value, and then use all of that data to help figure out how we do balance all of those lenses of talent and competitiveness and budget and what associates want to produce something that makes a compelling benefit package overall for our associates.
Yeah, and I think that raises an interesting point, actually. I wanted to go back to something that you said earlier, too, about the process through which you had this consultation with a leader of a group that had a certain type of need that was evident among the workers and the associates in their department and their group. And I think given all the data that you have at your fingertips in the snapshot, you have the ability to disaggregate, to analyze the data from a lot of different lenses. And I think in light of, just what we've seen over the last year, people are experiencing the COVID experience. Yeah, and I think that raises an interesting point, actually. I wanted to go back to something that you said earlier, too, about the process through which you had this consultation with a leader of a group that had a certain type of need that was evident among the workers and the associates in their department and their group. And I think given all the data that you have at your fingertips in the snapshot, you have the ability to disaggregate, to analyze the data from a lot of different lenses. And I think in light of, just what we've seen over the last year, people are experiencing the financial crisis as a result of COVID in many different ways. I'm curious to what extent you have been able to, or how you think about looking at different segments of your associates, using the data you have and really, isolating specific needs and prioritizing those.
Yeah, absolutely. I think that, first off, I would say that, we really, when the pandemic did hit, we moved to respond to what even before we had identified, exact needs, we were moving to respond in ways that we felt like we're going and trying to anticipate what some of those needs were going to be, around time off, around some greater flexibility to work in a remote capacity with all of the stresses that come with kids being out of school and things of that nature, but also financial, and so we were looking at, how we can implement solutions that gave people additional support and resilience and flexibility, financially at this time. One of the things that we were able to do with a lot of the data we had from the snapshot is we had progressed from just looking at it by organizations to actually also looking at it through some other lenses. We have network resource groups, which most organizations probably have in some name, we have been able to look at those groups and understand potentially some of the strengths, you know, and the opportunities, the vulnerabilities of some of those groups. And so throughout the pandemic, as we've been offering any solutions, whether it's our standard benefits and looking at utilization, you know, medically, things of that nature, but also especially for some of the new benefits that we were offering and really, you know, putting out there to help support people over the last year, we were looking at that through some of those lenses that we've become already accustomed to looking at, you know, through a lens of people of different ethnicities, you know, through different pay, you know, sort of tiers or salary tiers. Our moderately paid associates, which we sort of define as those generally, you know, making under about $50,000 a year, is of particular importance to us to make sure that we're protecting them and that we're understanding the impact on them, you know, because it's probably amplified, especially in a financial capacity, when there's shocks to the system, when there's, you know, additional demands placed on their finances by unforeseen events, et cetera.
Well, Ryan, I feel like we could continue talking about this for much more time. I really appreciate your time. I think we're out of it for now, and just really thank you for sharing your insights with our audience today.
Yeah, absolutely, Beth. Thank you so much for the opportunity to come and share. You know, I really think that, you know, as a main takeaway, I think that just sharing the data and sort of democratizing making it transparent has really, I think, enabled us as a culture to shift and to include everybody in that process of having that culture progress and shift and grow. So I certainly appreciate the time. Thank you very much.
Thank you.